Thank you very much, Chair Ochoa. Good morning to all the friends of CDU, our Board of Trustees, distinguished faculty, alumni, and students, and all the other guests who are joining us today. Thank you for attending our State of the University address in this, the university's 55th year. I am coming to you, as I was last year, live but virtually from our campus in South Los Angeles. Despite the ongoing circumstances of the pandemic, Charles R. Drew University of Medicine and Science has continued to thrive and proceed on its upward trajectory. We came into this public health crisis as a hidden gem, well known to our immediate neighborhood and stakeholders, but perhaps somewhat off the radar beyond that, no more. The perseverance of our students, faculty, staff, and the entire CDU community in the face of historic challenges and times has lit the university's collective spirit like a flame that is attracting donations, partnerships, and new avenues of support to grow our university. Most importantly, it is attracting students looking for a place to gain the knowledge, skills, and expertise to change health outcomes and make a difference in their communities, in our community. Through this, we are fulfilling our promise and our mission of cultivating diverse health professional leaders who are dedicated to social justice and health equity for underserved populations through outstanding education, research, clinical service, and community engagement. From Compton to Watts, Linwood to Willowbrook, in South Central Los Angeles and beyond, CDU's mission and promise clearly resonates with people who want to make a difference, starting with our students. Enrollment at CDU reached an all-time high during the academic year 2020, propelling us beyond the 1,000-student barrier to exceed 1,100 students this fall. Where do they come from? Ask our students, and they will often cite the significance of our mission, our drive towards fulfilling our promise, and how deeply CDU resonates with them. Isara Macias, a recent College of Science and Health graduate, told us she chose CDU because one of her many values is compassion, which is what propels her to hear the voiceless and to advocate for the oppressed. She also told us that from the very beginning, she knew CDU was a mission that she had to be a part of. When I asked how he would leverage his CDU education throughout his career, College of Medicine graduate Kalanji Cole stated that he wanted to utilize his advocacy skills to lobby for equitable access to high-quality health care for all patients, no matter their social or financial status. For nursing alumnus Guada, Ann, and Daya, she says she was inspired to attend CDU because of the university's mission, curriculum, and promise to produce health leaders who would directly serve under-resourced populations, to work to target social injustices and health disparities, and create catalysts for change. We thank these students and the many others who echoed similar sentiments for their kind words and for their drive to carry the CDU mission forward in their careers and communities. The ardent dedication from students such as these drives us to continue fulfilling our promise. Dr. Charles R. Drew famously said, "Excellence of performance will transcend artificial barriers created by man." In doing so, CDU's namesake highlighted the unlimited horizons that exist for those who have the will and the opportunity to be their best selves. Our students bring their will, we provide the opportunity. It's something we take so closely to heart at the university that we enshrine the quote in our university's new grand entrance. In last year's remarks, I noted 2020 demonstrated the need for CDU's voice and work in the world at large. As more media outlets continue to shed light on racial and social inequities, it's easy to get swept up in a desire to bemoan how long it took and what it took for our nation to significantly begin realizing and acknowledging that these inequities exist. After all, those of us whose work has been rooted in providing culturally conscious care, health education, and equitable policymaking have been well aware that these long-standing systemic and structural inequities exist. However, I suggest that we instead broaden our perspectives to see the value and opportunity this increasing national awareness brings. For example, when we learned last year that affluent communities were more likely to have access to COVID-19 testing sites, we leveraged our awareness into action by partnering with LA County and other valued partners to launch the CDU COVID-19 testing site right here in South Los Angeles, which tested over 80,000 individuals in just under 4 months. The effort was Herculean, and the responsibility was extraordinary, but we fulfilled our promise and vision of directly enhancing health equity in Los Angeles. CDU students, faculty, and staff tirelessly staffed the site, directly interfacing with our communities to make a measurable difference in a time of historic crisis. Through these dedicated actions, more people and organizations came to recognize the importance of investing in resources such as CDU. The most recent and perhaps most notable investment happened this year when Governor Gavin Newsom approved the annual state budget, granting CDU a one-time $50 million allocation. This significant funding will support the university's upcoming new 4-year medical degree program, which will in return benefit the state by increasing the number of Black and Latino medical graduates in the healthcare workforce. That level and investment of support for our university, with its humble yet ambitious beginnings as 2 mobile buildings on 120th Street 55 years ago, is inspiring. And it doesn't stop there. Bloomberg Philanthropies' Greenwood Initiative, helmed by former New York City Mayor Michael Bloomberg, has invested over $9 million in the university, starting with their award of $7.7 million granted last September. This largest private gift ever presented to CDU allows the university to provide nearly 75% of our medical students on financial aid with up to $100,000 in tuition support. This is already equated to over $3.6 million in scholarships, allowing our students of color to focus and thrive in their medical education without worrying about the burden of massive debt. The Greenwood Initiative followed up with another $1.6 million grant to the university this April, enhancing our efforts to provide COVID-19 vaccinations and add several mobile health units to CDU's community outreach efforts toward protecting vulnerable populations. Last fall, the California Office of Statewide Health Planning and Development granted $8.6 million to our College of Medicine and School of Nursing to support our residency programs. LA Care Health Plan this year announced a $5 million commitment to support our upcoming and new medical school as a continuation of their ongoing partnership with CDU. This initiative has granted more than $8.4 million in funding, which has allowed CDU to provide full scholarships to 16 medical students. A groundswell of other donors and supporters has also stepped up to support our mission. Organizations such as the California Endowment, the California Wellness Foundation, California Healthcare Foundation, Rose Hills Foundation, LA Care, the Confidence Foundation, Northrop Grumman, Kaiser Permanente, Cervicon, and Alpha Kappa Alpha Far Western Region Incorporated all have together contributed over $4 million to the university in support of student scholarships and initiatives. I am reminded of a very salient phrase from the report issued by the McCone Commission, appointed to examine causes and recommend policies in the wake of the 1965 Watts Uprising. It described education as our fundamental resource. The inspiring level of funding that we have received shows that others believe this to be true. These are investments in our students, in the community, and in our society. I extend a heartfelt thank you to everyone whose support moves our mission forward and allows CDU to fulfill our promise and provide this fundamental resource. Speaking of investing in CDU, our institution has a long-standing history of hiring high-impact faculty members based on their expertise in addressing the politics, economics, and determinants of health in their communities. Each year, we honor select members with our outstanding faculty awards. Recognizing these recipients is always a personal highlight for me. This year, Dr. Roberto Vargas received the Outstanding Professor Award. Dr. Magda Shaheen was awarded the Outstanding Research Award. And the late Dr. Ingrid Roberts-Terrell was posthumously awarded the Outstanding Teaching Award. Congratulations to them all. This new school year comes on the heels of graduating the largest class in the university's history. CDU conferred 489 degrees at this year's commencement ceremony to a diverse class that represents our inclusive culture. Now, we prepare to embark on our next journey as a university. This includes opening a 4-year medical education program and undertaking a significant expansion of our campus footprint. The forthcoming medical education program, pending LCME review and approval, will graduate an additional 60 medical students each year, which will increase the number of Black medical school graduates in the state of California by almost approximately 30%, and Latinx medical students by almost roughly 20%. And that is when it graduates the first class of students in 2027. CDU and APLA will welcome the upcoming opening of the Avis and Mark Ridley Thomas Wellness Center on our campus. The center will provide urgent care, mental health counseling, and wellness programs to students, CDU students, faculty, and staff, while the APLA clinic will provide primary medical care, dental care, and behavioral health services to our local community. This year saw the launch of our internal medicine residency program, which will enroll as many as 24 students by the summer of 2024. Since the return of residency training to the university in 2018, we have retrained and developed nearly 50 residents. Their focus is providing care throughout Los Angeles County's service planning areas 6 and 7, which have long been federally designated health professional shortage areas. Additionally, our family medicine residency program graduated its first cohort of 7 residents, marking the first time that medical residents have graduated in South Los Angeles in 15 years. CDU's College of Science and Health also had an exceptional year under the leadership of Dean Hector Balcazar. The Community Health Worker Academy graduated its first cohort of 10 graduates. This puts the university at the forefront of pioneering health education by providing state-of-the-art training opportunities to community health workers and instilling the knowledge necessary to administer culturally appropriate care tailored to the communities they serve. I am pleased to report that all graduates of the Academy's first cohort have already successfully secured permanent employment at their internship sites and other LA County healthcare systems. Meanwhile, CDU's Mervyn M. Dimely School of Nursing is establishing our first doctorate of nursing practice program. I'm happy to say that the Western Association of Schools and Colleges approved that program just last night. Congratulations to the School of Nursing. This allows us to address the ongoing nursing shortage that affects residents in our community. Additionally, the School of Nursing has received accreditation for our family nurse practitioner program and our psychology mental health nurse practitioner program. Finally, we'll be welcoming our first group of students in our new Bachelor of Science in Nursing degree program this fall. CDU is also a research institution holding the same mission and goals as our educational activities. The university has 56 active research awards totaling $26 million. Under the leadership of Dr. Jay Vadgama, CDU's Vice President for Research, the university was recently awarded $2.6 million from the American Cancer Society to increase diversity in the biomedical research by expanding CDU's career development activities around cancer research. Our research enterprise has collaborated with 3 other historically Black medical schools and the pharmaceutical company Regeneron to develop a sequence database primarily for African American individuals. This genomic database will help develop research and clinical program highlighting efforts to address health disparities with technology. The partnership will also result in a genetics counseling program, also approved by the Western Association of Schools and Colleges just this very week. as well as a graduate medical genetics program in the future. CDU supports, welcomes, and appreciates when our graduates find their careers to be rewarding on many levels. Therefore, we took it as a point of pride when PayScale, a leading provider of compensation data and software, conducted an analysis of alumni salary data from 3.5 million respondents from over 4,000 colleges and universities across the United States. The results, published in Forbes this summer, showed CDU alumni reported the 5th highest average pay for new bachelor's degree recipients in the entire country. Altogether, our recent accomplishment and immediate plans represent a clear marker of progression in our institution's 55-year journey. We are taking major strides towards solidifying the legacy of our institution and propelling us beyond our hidden gem status to a more significant position on the higher education landscape. We are on the path to building CDU into a full-service university. Our commitment to graduate education has been very evident, but now we are also looking at our undergraduate programs as an ideal opportunity to further our mission. Indeed, the biggest drop-off in diversity in the health professions occurs at the college level. So this is why we are ramping up there as well. Our ongoing North Campus expansion of 14 acres was embarked upon as a signal of institutional commitment to undergraduate education. Many of these students will elect to continue into graduate school, either here at CDU, or carry our diversity to other graduate level programs across the country. Although it has been a phenomenal year for the university, and our future looks equally promising as an institution, I would be remiss if I did not acknowledge the profound ways that this past year and a half has affected the greater CDU community. The path through the pandemic has not been easy, and all of us are not done walking it, though the light at the end of the tunnel sometimes appears to be tantalizingly close. We have made it this far due to the grace, strength, fortitude, and heroic perseverance of our students, faculty, staff, and the extended campus community. Our success is a reflection of all who have embodied the spirit of CDU in trying times. Thank you to each and every one of you. It truly gives me a distinct sense of pride to be at the helm of a university that can come together as well as this one has. I look forward to what we'll accomplish in the year ahead and beyond as we continue to make strides in expanding access to health education and ultimately improving the health of our community and others like it. We will continue to fulfill our promise. Thank you very much.